See, liver is a very forgiving organ in the body, and it does not give much in the way of symptoms. So it is not like an organ like stomach or intestine. When it is upset, it gives you pain.
Sir, suppose if person is having fatty liver problem, how can he be diagnosed with that? What are the symptoms of that, sir?
When there is more weight in our body, especially in the abdomen, when there is more central weight, and that puts fat into the liver. So this is what we nowadays call as fatty liver, which is extremely common. If we were to follow the instructions what we suggest and have a good diet, then your fatty liver can be fully reversed, provided we pick it up at an early stage.
Hi, hello, namaste viewers. Welcome back to our YouTube channel. I am Shweta from Bangalore Gastro Centre. Nowadays, we hear a lot about fatty liver. So, what do you mean by fatty liver and can it be cured? What are the foods we have to intake? What are the foods we have to avoid? To give more information about this, we have Dr. Yoganand Reddy, gastroenterologist with us today. Sir, namaste.
Namaste.
Sir, first of all, what is fatty liver? And these days we are seeing fatty liver as very common problem. Sir, why is it, sir?
So fatty liver is a condition where there is excess of buildup of fat in the liver. So normal healthy liver doesn't have much fat. So when the liver gets more fat, for example, normal healthy liver might weigh about 1 to 1.5 kg. So out of that 1.5 kg, if we have 150 grams fat, then that starts to show on the scan. So this is what we call as fatty liver. So nowadays we are seeing this extremely common because in the cities especially, our lifestyles are changing. There is more sedentary kind of work. People are spending long time sitting in the office. There is not much physical activity. And as a population in general, we are getting a little bit more chubby and heavy. So when we are putting weight, especially in the center of the abdomen, when the weight gain happens, that puts fat into the liver. So this is one of the common causes. Of course, drinking alcohol regularly can also cause damage to the liver and can cause changes of fat in the liver. But a lot of patients I see in my clinical practice say that, sir, I never drink any alcohol. Why have I got it? So the common cause nowadays is non-alcohol related, which is to do with gaining excess of weight, sedentary lifestyle. Sometimes they might have conditions which they might not even know of. So they might have an underactive thyroid where they have gained a lot of weight without knowing, or some women with polycystic ovaries may have gained weight. So there are reasons sometimes for gaining weight, and they might be on some medicines sometimes that might have also contributed to the weight gain. So overall, when there is more weight in our body, especially in the abdomen, when there is more central weight, and that puts fat into the liver. So this is what we nowadays call as fatty liver, which is extremely common. So in the cities like Bangalore, for example, if we take 10 people, I can guarantee that at least 3 people will have fatty liver disease.
Okay, sir. Sir, suppose if person is having fatty liver problem, how can he be diagnosed with that? What are the symptoms of that, sir?
So, see, liver is a very forgiving organ in the body, and it does not give much in the way of symptoms. So it is not like an organ like stomach or intestine. When it is upset, it gives you pain. So liver is in fact the most forgiving organ in the body. That is why a lot of people don't realize that there is damage in the liver. So quite often this fatty liver is picked up on a scan they would have had for a health checkup, or they would have had an ultrasound scan for some other reason, and then the report says that there is fatty liver grade 1, grade 2, grade 3. So patient naturally gets concerned as to what is this, why have I got it. So there is as I mentioned, a variety of reasons for it, and we don't usually expect symptoms from fatty liver disease at an early stage because liver doesn't give symptoms on a daily basis. But when the fatty liver starts to get worse, so when there is more and more liver damage, that is when we start to see symptoms. So symptoms, what you can expect, for example, it will be some discomfort on the right side where the liver is located, sometimes feeling generally tired or feeling lethargic as if there is no energy to do things. generalized itching, and at a later stage they might also start to see yellowness in the eyes and skin, what we call as jaundice. As the liver disease gets worse, sometimes there is fluid in the abdomen that starts to accumulate, so they start to get fluid in the legs, fluid in the abdomen, making the abdomen look bigger. So these are mainly symptoms at a later stage of fatty liver. When in terms of how is it diagnosed, as I mentioned, quite often it is picked up on some routine scan, and people would have had health checkup, blood tests, where they see sometimes changes in the liver enzymes, what we call as SGOT, SGPT, and they are not sure why they are abnormal. And when they come to the hospitals like gastroenterology units like ours, we usually go through their history to see firstly, do they have any medical conditions? Because this fatty liver is also associated with sugar, BP, cholesterol. So we look for other conditions, look at their body mass index to see what is their height, what is their weight, are they overweight, are they obese? And most of the time simple scan like an ultrasound scan is enough to tell they have got fatty liver disease. But in some people, we also like to do a special scan, which is also like an ultrasound, but it's called fibroscan, which gives us more information about the amount of fat that is deposited in the liver, but also what is the damage it is doing to the liver, what we call as fibrosis. Fibrosis is essentially scarring in the liver. So let's say, for example, we have a cut on the hand. When it heals, it leaves a scar. Like that, internally in the liver, there will be scarring, what we call as fibrosis. So in some people only where the liver doesn't look quite right on an ultrasound scan, we might do occasionally a CT or an MRI scan. But in most people, a simple liver blood test and an ultrasound scan is enough to give a diagnosis of fatty liver.
Okay, sir. Can it be reversed, sir?
So it's a very good question. Most people who come to the gastroenterology practice, this is one of the things in their mind. Have I got serious liver damage? Can it be reversed? And there is a lot of misinformation in our country, unfortunately, about liver. But the good thing is you can completely reverse fatty liver anything between 6 weeks to 6 months, provided you follow the instructions that what we suggest. If you're obviously drinking alcohol, you need to cut down or leave alcohol completely. And any lifestyle changes that we suggest you have to follow, any weight reduction we suggest you have to follow. So if you were to follow the instructions, what we suggest, and have a good diet, then your fatty liver can be fully reversed, provided we pick it up at an early stage.
Sir, what are the complications we can see when we have fatty liver problems, sir?
So, as I mentioned, as the fat in the liver starts to deposit, there is scarring, and this scarring starts to cause permanent damage to the liver, what we call as cirrhosis. So, once somebody gets cirrhosis, which is an irreversible damage, so the liver cannot go back to normal. So, gradually over a period of time, this fully damaged liver will start to get worse. And so the complications we expect are mainly from a cirrhosis of the liver, which is mainly what we call as liver failure, because the liver starts to slowly shut down, and this starts to give problems like they start to get fluid in the abdomen, fluid in the legs. Some people having to come to the hospital repeatedly to get the fluid relieved, because otherwise they get very distended. They might need to take a lot of medicines to drive that excess fluid. As the liver fails, there will be jaundice, that yellowness which doesn't go away. And there is only a limit to how much the liver can function after that. And in some people, to save their life, they might require a liver transplant. So liver transplant is essentially putting a new liver to somebody to save their life. And unfortunately, some people don't get the right liver on time, and they might actually die from liver disease itself. And also there is sometimes cancer in the liver which has got cirrhosis. So that is a risk, and when a cancer develops in the liver which is already damaged, the treatment options can also be limited. Some people might present for the first time to the hospital with vomiting a lot of blood. That is because they have enlarged blood vessels in the food pipe and the stomach which may have burst, and that might be the first time they know that they have a liver problem. And in some, they end up coming to the hospital repeatedly because of one thing or the other from liver disease. So there is a lot of kind of money spent, hospitalizations, and frequent hospital visits alongside the other complications which I've just mentioned.
Okay, sir. Sir, if at all we should avoid that fatty liver problem, what are the foods we have to intake and what are the foods we should not have?
So, fatty liver is mainly a problem, as I mentioned, in the cities. That is because we are overindulging in foods that have got high amount of calories. So nowadays, even if the weather is bad, if we can't even go to the restaurants, it's easy to just to click on the app and get food sitting at home, and we start to consume all these calorie dense foods. So if we are repeatedly consuming these high calorie foods, naturally we will gain weight. So one of the important things to firstly avoid is cutting down on eating outside in the restaurants and ordering takeaways, because these foods have got high amount of calories. Secondly, cutting down on any kind of processed foods. Processed foods are foods that are in packages, in tins, that have got very little or no fiber, but also have a lot of calories, preservatives, additives, coloring agents. And people who eat non-veg, especially if they're eating red meat frequently, which has got a lot of fat, that can also start causing problem. And some people say that, sir, I'm only eating vegetarian food, and how come I have got fatty liver? So it doesn't mean that you're a vegetarian and you can't get fatty liver, because there is a lot of unhealthy vegetarian food people consume. So if you're frying foods, for example, this pakodes, bhaji, bonda, gulab jamun, sweets, various ones, they have high calories, saturated fats. So that can make you gain excess of weight. So cutting down on these kind of foods, this will all certainly help. And also limiting the salt intake in our food will also be good for the liver. In terms of what are the foods that one should eat to improve the liver, you need to look at your plate and see, have I got different colors on my plate? So having a good mixture of variety of vegetables, good amount of fruit in your diet, and ensuring that your diet has got good amount of fiber that will naturally come from vegetable and fruit, because fiber keeps us feel full. Fiber gives us fuel for our body, and it also reduces this sugar spikes in our body, thereby less chance of what we call as insulin resistance, which is one of the main issues in fatty liver. And there are certain superfoods for the liver. For example, eating good fats like walnuts, almonds, and these are fantastic. Although they are fatty, they are good fats like avocado, olives. For those who are eating non-vegetarian and they wish to continue, they can eat non-veg. Now, non-vegetarian doesn't mean that fatty liver doesn't mean that non-vegetarian food should not be taken. You can take lean portion of chicken, for example, chicken without skin that is not fried, that is cooked or grilled, and fish that is not fried. These are lean protein they can consume, but try and keep 70% of your diet to more of a vegetarian plant-based protein. And apart from the foods, it is also important to have regular exercise, because unless you lose weight, the excess of fat in the abdomen will not move. So the cornerstone of treatment for fatty liver disease will be losing that weight. In a lot of people we see in our clinical practice, we give them a set target of at least 10% of their body weight to lose. So that moves that extra fat out of the liver to get the liver back to normal.
Sir, thank you so much for giving lots of information about this fatty liver. Thank you, sir.
Thank you.
So viewers, today we came to know about fatty liver. So for more further informative videos, please subscribe our channel and share to your friends also. Thank you.